Lymph means clear water in Latin, and it describes the fluid that flows through the lymphatic vessels and lymph nodes, which make up the lymphatic system. The three major roles of the lymphatic system, the reason we need it in the first place, are that it returns fluid from the tissues back to the heart, it helps large molecules like hormones and lipids enter the blood, and it helps with immune surveillance to keep infections from running amok. So let's take a closer look at lymph and where it comes from. The blood in the arteries is under a lot of pressure because it needs to reach every little nook and cranny of the body. Those arteries branch out into narrower and narrower arteries, and then arterioles until finally it gets to the capillaries, which have walls that are only 1 cell thick and are slightly porous. Red blood cells are too big to fit through the capillary pores, but small proteins like albumin and fluid can make it through. Every day, 20 liters of fluid, water, and protein seep out of the capillaries and becomes part of the interstitial fluid between the cells. About 17 liters gets quickly reabsorbed back into the capillaries, but that leaves around 3 liters of fluid behind in the tissues each day. This 3 liters of fluid needs to find a way back into the blood so that the body's interstitial fluid volume and blood volume both stay constant over time. That's where the lymphatic vessels, or just lymphatics, come into play. They collect excess interstitial fluid and return it to the blood. Once the interstitial fluid is in the lymphatic vessels, it's called lymph. You might be wondering how there can be 20 liters of fluid seeping out each day if the blood volume is only 5 liters. Well, remember that the 5 liters is constantly in motion, and that it gets recycled over and over every single day. Unlike the circulatory system, the lymphatic system isn't a closed loop, because fluid and proteins make their way into the microscopic lymphatic capillaries, and all of the collected lymph is dumped into the veins. Lymphatic capillaries are the smallest lymphatic vessels, and they're located throughout the interstitial space. Lymphatic capillaries are extremely permeable because their walls are made of endothelial cells that only loosely overlap, forming one-way mini-valves. These endothelial cells are anchored to structures in the interstitial space by collagen filaments, which allows the lymphatic capillaries to stay flexible but retain their overall shape. When the pressure in the interstitial space is greater than the pressure in the lymphatic capillary, the endothelial mini-valves open up, allowing fluid to get in. When the pressure in the interstitial space is less than the pressure in the lymphatic capillary, the endothelial mini-valves are pushed shut, which keeps the lymph inside. Once that lymph is inside the lymphatic capillaries, it travels through bigger and thicker walled vessels, then trunks, and then ducts. There's no pump pushing lymph through the lymphatic system. Instead, smooth muscle in the lymph vessels reacts to the pulsing of nearby arteries by squeezing to get things started. And then the squeezing of skeletal muscles, which normally contract throughout the day, exert external pressure to keep the lymph flowing along, eventually reaching a nearby lymphatic trunk. To keep the lymph from sliding backwards, the lymphatic vessels have valves just like the veins do. The lymphatic trunks are each named after the regions of the body that they drain the lymph from. 2 lumbar trunks, 2 bronchomediastinal trunks, 2 subclavian trunks, and 2 jugular trunks, as well as 1 intestinal trunk. From there, the lymph is delivered to either the right lymphatic duct, which collects lymph from the right arm and the right side of the head and chest, or the thoracic duct, which is a lot bigger and collects lymph from the rest of the body. The right lymphatic duct dumps lymph into the junction of the right jugular vein and the right subclavian vein, and the thoracic duct dumps lymph into the same junction on the left side of the body. That particular spot is perfect because it's where the pressure is very low, which makes it easier for the lymph to flow in. The lymphatic system has key advantages. For example, it can pick up larger molecules, like hormones, that are too big to get into the capillaries, and then get them to the bloodstream. The lymphatic system can also help get nutrients to the tissues. For example, during a meal, fatty acids get packaged into balls of fat called chylomicrons by the small intestine. But just like the hormones, these are too big to move across capillaries. Instead, the chylomicrons go into special lymphatic vessels called lacteals. which get their name from the fact that the lymph that flows through them looks like milk. The chylomicrons slowly make their way up into the thoracic duct and get dumped into the venous blood. Now, the lymphatic system also plays a role in immune function. Lymphoid organs remove foreign material from the lymph to keep it from entering the bloodstream, and act as lookout points for the body's immune defenses. Some lymphoid organs are in the form of diffuse lymphoid tissue, where they're just a loose arrangement of lymphoid cells and protein, typically in the lining of the gastrointestinal and respiratory tract. Another type of lymphoid organs are lymph nodes, which are tightly packed balls of lymphoid cells and protein. Hundreds of lymph nodes cluster along the lymph vessels, each one a few millimeters to about 1 to 2 centimeters in size. When they're concentrated along the lymph trunks, you can feel them, especially in the neck, armpit, and groin. They can also be found in the intestinal wall, where they're called Peyer's patches. When an infection gets into the tissue, it can slip into a lymphatic capillary and move into a lymphatic vessel. Unfiltered lymph fluid drains into a nearby lymph node, where any pathogen or piece of a pathogen is quickly detected by a dendritic cell, which is a type of antigen-presenting cell that serves up pieces of anything it destroys to other immune cells. In the lymph nodes, dendritic cells continuously sample the lymph and present antigens that they come across to the B cells, which are a type of lymphocyte that can make antibodies. B cells are designed to only react to foreign antigens, and if the dendritic cell presents something foreign, the B cell turns into a plasma cell and starts cranking out antibodies, which then flow into the lymph and exit the lymph node. There are also circulating T cells, which are another type of lymphocyte that move between the lymph nodes, lymph, and blood, on the lookout for pathogens and infected or abnormal cells that have been tagged by antibodies. Another lymphoid organ is the spleen, which is about the size of a fist and sits on the left side of the body below the diaphragm and on top of the stomach. The spleen has both white pulp and red pulp. The white pulp is where antibody-coated bacteria are filtered out of the circulation and antibodies are generated by B cells. In a sense, the white pulp of the spleen is like a giant lymph node, although unlike a lymph node which receives unfiltered lymphatic fluid, the spleen receives blood. The red pulp of the spleen is where old and defected blood cells are destroyed, and their parts, which are the hemoglobin, the heme chain, and the iron, are either broken down or recycled. The spleen is also helpful in that it keeps red blood cells and platelets available in case they're suddenly needed by the body. Really, it's an organ that's got your back in an emergency. Another lymphoid organ is the thymus, which is in the upper part of the chest, just below where a necklace might sit. The thymus is most active in the neonatal period and pre-adolescent years, and then slowly atrophies and gets replaced by fat after puberty. The thymus is involved in the development of T cells, making sure that any T cells that react to self-antigens, antigens that are normally found in the body, are promptly destroyed. A final set of lymphoid organs worth mentioning are the tonsils, which include the adenoid, tubal tonsils, palatine tonsils, and lingual tonsils. Together they form a ring of lymphoid tissue around the throat, and their main job is to trap pathogens from the food you eat and the air you inhale. Alright, as a quick recap, the lymphatic system refers to the one-way network of lymphatic vessels that allows lymph, which is a clear fluid that's squeezed out of the blood, to transport nutrients to cells and act as a method of waste removal. Lymph is cleansed at lymph nodes throughout the lymphatic system, which play an important role in immune function.
Your lymphatic system quietly plays a vital supporting role to both your cardiovascular and immune systems. For one thing, it maintains your homeostasis by eventually returning most of the fluid that has been diverted back into your blood, keeping your blood volume levels where they need to be, for keeping you from collapsing from low blood pressure, and for preventing you from dying from a staph infection every time you scrape your elbow. You have to thank the unsung hero of your anatomy, your lymphatic system. Structurally speaking, your lymphatic system consists of three main parts. The first is just your lymph. It's a watery fluid that flows through your lymphatic system. Much of your lymph starts out as blood plasma that gets forced out of your capillaries way down in the capillary beds, where the leakage helps the exchange of nutrients and gases between the blood and the capillaries and the hungry cells in your tissues. The blood capillaries reabsorb some of the fluid, but a lot gets left behind. So much of the rest of your lymphatic system works to soak it up and get it back to where it needs to go, inspecting it along the way. For example, you have a network of lymphatic vessels that help reabsorb the fluid at about 600 or 700 lymph nodes, which are basically checkpoints that monitor and cleanse lymph as it filters through. Then there are special lymphoid organs like the spleen, thymus, adenoids, and tonsils, as well as other lymphoid tissues throughout the body. Some of these organs and tissues house special defensive cells of the immune system to fight infection by gobbling up bacteria and other harmful antigens. Others, like the thymus and spleen, provide a nursery for maturing immune cells called lymphocytes. But to understand the special supporting role that your lymphatic system plays in your body, let's start with its origins in the capillary beds of your circulatory system. You'll recall that these beds are where the capillaries carry blood from your arterioles and your arteries before that, and feed blood into your venules and eventually your veins. This is where the transfer of nutrients and waste takes place, as blood pressures force plasma out of the arterial end of the capillaries and into the interstitial fluid between the cells of whatever tissue you happen to be in. And most of that fluid gets drawn right back into the capillaries on the venous end thanks to osmotic pressure. But some is left behind. Of the 20 liters a day that's forced through the arteriolar end of all the capillaries all over your body, only 17 liters is taken back up by the venous end. Those other 3 liters? That becomes your lymph. It's almost immediately picked up by nearby lymphatic capillaries that wind their way in and among the blood capillaries, and they're really well suited for their job. Lymphatic capillaries are made of loosely overlapping endothelial cells that look kind of like roofing shingles, forming little flap-like valves that only open in one direction. So when the pressure in the interstitial space becomes greater than the pressure inside the lymphatic capillary, the flaps push open and take in fluid to relieve the pressure. Once the fluid is inside a lymphatic capillary, we can officially call it lymph. Then it flows through successively larger lymphatic vessels to collecting vessels and then the larger trunks, and finally into one of 2 big ducts that feed back into the lowest pressure area of the circulatory system. The right lymphatic duct drains all the lymph collected from the upper right area of the torso, as well as the right arm and the right sides of the head and thorax, and feeds them all into the internal jugular vein. The larger thoracic duct takes lymph from the rest of the body and dumps it into the subclavian vein. Overall, these vessels work a lot like your veins do. They operate under very low pressure, have a series of valves that prevent backflow, and are helped along a bit by smooth muscle in the vessel walls that keep the fluid moving. Okay, so the lymphatic system takes extra fluid that's squeezed out of the blood capillaries and basically mops it up. That sounds handy, but as a living thing that wants to stay alive, what's in it for you exactly? Well, remember, we're talking about recovering 3 liters of blood fluid per day. That's more than half your total blood volume. If that weren't returned to your circulatory system, you'd be looking at a serious drop in blood pressure and little to no oxygen delivery or waste pickup. Plus, any blockage in the lymph system, like from a tumor that obstructs one of your vessels, can be really dangerous, resulting in edema or swelling that can constrain blood flow and lead to serious complications. And finally, don't forget that your lymph also plays a key role in the function of your immune system. Say you scrape your elbow and some bad stuff, like the staphylococcus bacteria that's covering your entire body right now, infiltrates some of the loose areolar connective tissue under your skin. Since that tissue is full of interstitial fluid that drains into your lymphatics, which ultimately drain to your heart, you're gonna want to vanquish those bad guys before they have a chance to wreak any havoc. Well, this is where your lymph nodes come in. Your body's main lymphoid organs, the lymph nodes, are where your lymph gets close and regular inspection by its resident immune cells, lymphocytes. Depending on what kind of troublemaker they find in the fluid, the lymphocytes might trigger the release of resident macrophages to attack unwanted microorganisms, or they might activate the general immune system outside of the node if they need extra support. Lymphocytes are found in and mature in the loose reticular connective tissue that makes up a large part of the nodes and most of your other lymphoid organs. Now, if a node is overwhelmed by whatever invader it's trying to quell, it may become inflamed. You can actually feel some of your nodes if you poke around the sides of your neck. They feel like little bumps. Noticeably enlarged lymph nodes are often an early diagnostic sign of disease or infection, which is why doctors are always feeling around under your jawline during checkups. But your lymph nodes aren't the system's only checkpoints. You've also got a few special outposts placed at strategic entry points to particularly sensitive tissues, like those in the respiratory and digestive tracts. These are called mucosa-associated lymphoid tissues, or MALTs, because they can be found in mucous membranes around the body outside of the lymphatic vessels. Your tonsils are some of the largest collections of these tissues, which together form a ring around the entrance of the pharynx. There, they can inspect everything you eat and breathe and try to remove any pathogens before they enter the GI tract or lungs. It's a pretty big job, actually, which is why sore throats and swollen tonsils are a common sign of a cold or other infection. Another collection of malts, called Peyer's patches, are in the distal portion of the small intestine, providing another checkpoint along the GI tract. And contrary to popular myth, your appendix is not useless because it too contains a bunch of lymphoid tissue and is conveniently located where it can destroy any remaining bacteria before it can breach the intestinal wall during absorption. Exactly how your lymph and immune cells detect and destroy the unwanted visitors that might otherwise kill you is what we're going to be talking about for the remainder of this course. You may not know it, but your body is engaged in a never-ending battle. You are literally covered in staph and strep and E. coli and all sorts of dubious characters that are intent on using you and your body's many resources to feed themselves, find shelter, and reproduce as much as they want. Your body has developed a three-part policy toward these shady customers, and its enforcement is handled by your immune system. The immune system is different from all the other systems we've talked about this year in that it's not a specific tissue, organ, system kind of system. Instead, it involves a whole bunch of different tissue groups, organ systems, and specialized but widely distributed defense cells. Together, this league of extraordinary substances joins forces to perform all of the defense functions your body depends on to keep you alive in an incredibly germy world. And the first line of defense in this never-ending battle? That's your innate or non-specific defense system. Like your average frontline soldier, it's prepared to immediately engage with anyone suspicious, and it mostly includes stuff we were born with, like the external barricades of your skin and mucous membranes, and internal defenses like phagocytes, antimicrobial proteins, and other attack cells. But some enemies must be fought with special forces, and here your body can deploy your adaptive or specific defense system, which is more like your SEAL Team 6. It takes more time to call in, but it's specially designed to go after specific targets, and it keeps files on those bad guys so it knows how to handle them next time around. We're going to focus on your innate system and look at how it uses an arsenal of physical and chemical barriers, killer cells, and even fever to keep you healthy, proving that sometimes the symptoms we associate with illness are actually the signs that we're healing. Just because something is simple doesn't mean that it can't be elegant. I mean, your body is capable of some incredibly sophisticated things, including defending itself from infection. But occasionally, there's something to be said for brute force. And a lot of your innate immune system's functions aren't exactly subtle. For example, your body's very first line of defense is a simple physical barrier. And it works. Like a wall around a fortress, your skin does a fantastic job of keeping out all manner of malevolent microorganisms. As long as that tough, keratinized epithelial membrane doesn't get torn open or busted up too much, many mucous membranes also provide a handy physical barrier. They align any cavity that opens up into the germy outside world, including the respiratory, digestive, urinary, and reproductive tracts. Not only do your skin and mucosa supply simple physical protection, they also pack some serious chemical weaponry. Eat some questionable leftovers for lunch? Don't worry, your stomach is literally filled with acid, so you probably are covered. Your nasal passages can whip up a tissue box worth of sticky mucus to help trap viruses before they enter your lungs. You've also got bacteria-fighting enzymes in your saliva and lacrimal eye fluid, and peptides called defensins in your skin and membranes that help keep bacteria and fungi from setting up shop around inflamed or scraped skin. Which, no matter how careful you are, you're gonna get one way or another. But when you've breached that first simple line of defense, it's time to call on your second line of internal innate defenses. This is where your body starts pulling strategic maneuvers like firing up a fever, releasing chemical signals, causing inflammation, or other defensive tactics that help identify and attack infectious invaders. Some of the first defensive cells on the scene are your phagocytes. Their name literally means to eat, and like Pac-Man, they indiscriminately chase down intruders and gobble them up. And they come in a few different varieties. First, you got neutrophils, which are the most abundant type of your white blood cells. They kind of self-destruct after devouring a pathogen, and in fact, you've probably seen piles of their little dead bodies, because that's what pus is made of. But the bigger, tougher phagocytes are the macrophages. They're derived from monocyte white blood cells that have moved out of the bloodstream to occupy tissues, and some are free types that patrol tissues looking for creepers, while others are fixed, attached to fibers in specific organs, devouring anything suspicious that passes by. So when a macrophage, in say the finger I just cut slicing a bagel, sees a new bacterium coming along, it snares it using cytoplasmic extensions, reels it in, completely engulfs it, and essentially digests it and spits the rest out. And unlike neutrophils, it can do this over and over again. But not all your defense cells are phagocytic. You've also got cells with what is by far the awesomest name of any cell in the body, the natural killer cells. These tiny assassins patrol your blood and lymph looking for abnormal cells and are unique in that they can kill your own cells if they are infected with viruses or have become cancerous. How can they tell? A normal, healthy human cell contains a special protein on its surface called MHC1, or major histocompatibility complex, but if it's infected, it stops making that protein. And if an NK cell detects a defective cell, it doesn't swallow it whole like a macrophage, it pokes it with an enzyme that triggers apoptosis, or programmed cell death, which is pretty awesome. So those are some ways your innate immune cells handle their enemies, but how do they know where to look in the first place? So say you're in a banana factory and you slip on a banana peel and you scraped your knees. Your outer fortress has been breached and the pathogens are just flooding in. Now your body wants to contain the spread of pathogens, clean up the mess, and get healing as quickly as possible, so it cues up your inflammatory response. This is basically an internal fire alarm, only it uses chemicals instead of sirens to get the message across, and instead of smoke and fire, you sense redness, swelling, heat, and pain. For example, in the event of injury, specialized mast cells in your connective tissue send out histamine molecules. And histamine is great at calling in the cavalry. For one thing, it causes vasodilation, which creates redness and heat at the site of the injury. Now, those things might freak you out a little, but they're actually signs of healing. The increased temperature, for example, ratchets up the cell's metabolic rate so they could repair themselves faster. Meanwhile, histamines and other inflammatory chemicals also increase the permeability of blood vessels, causing nearby capillaries to release protein-rich fluids. This causes swelling, which again is actually a good thing because that leaked protein helps clot blood and form scabs, while the lymphatic system sucks up and filters that extra fluid, cleaning it up before putting it back into your bloodstream. And of course, like chum to sharks, an inflamed knee is also going to attract a bunch of local phagocytes, which find it easier to escape your now leaky capillaries, and lymphocytes that are also flowing freely, helping to destroy pathogens while also cleaning up dead cell wreckage. And don't forget, during all of this, the neutrophils have been doing their best, but they were the first wave to arrive, so by this time they're starting to die in heaps. They're triggered when the injured knee skin cells release chemicals that begin leukocytosis, the release of neutrophils from the bone marrow, where they're made, into the bloodstream. To attract the neutrophils to the damaged area, inflamed endothelial cells in the capillaries send out chemicals that act like homing devices. And when the neutrophils arrive, they cling to the capillary walls near the injury, flatten themselves out, and squeeze through the vessel walls to get to work. Your big monocytes eventually roll up to the battle and transform into hungry macrophages, replacing the first line of now dead neutrophils and basically just eating up any lingering enemies and then cleaning up the carnage. Now, all this works pretty well in most circumstances, but you may have noticed with a more major injury or an especially nasty virus or infection, sometimes your local troops get overrun. When white blood cells and macrophages run into more foreign invaders than they can handle, they let loose pyrogen chemicals that tap the hypothalamus and raise your body's thermostat, calling in a systemic fever to burn everything. The resulting temperature rise increases the metabolism of your cells so they can heal faster, and it also tells the liver and spleen to hold on to all of their iron and zinc so those things can't contribute to bacterial growth. But even then, sometimes you find yourself facing a more formidable foe. That's when you call in the specialists, your adaptive immune defenses. Sooner or later, a threat's gonna come along that's stronger than what the first responders can handle. That's when it's time for the adaptive or acquired immune system to step in. While your innate system takes its zero-tolerance policy very seriously and tries to toast any foreign microbe that it encounters, your adaptive system does things differently. It has to be expressly introduced to a specific pathogen and recognize it as a threat before it will attack. As its name suggests, you're not born with a working adaptive immune system. It's slow to act, in part because it takes time for it to shake hands with so many pathogens and get to know them. These introductions may be organic, like touching a dirty faucet in the bathroom or walking into a sneeze cloud, or they may be premeditated, which is why vaccination is pretty much the greatest thing to happen to medicine ever. But once it's been introduced to a potential threat, your adaptive defenses never forget it. And this ability to remember specific pathogens is one of the key differences between the adaptive and innate defenses. Another main difference is that adaptive immunity is systemic, rather than being restricted to a particular infection in, say, a sinus or a sliced finger, your adaptive system can fight throughout your whole body at once. And it does this by deploying one or both of its separate but cooperating defenses, your humoral immunity and your cellular defenses. Your humoral immunity, which you might not have heard of before, works by dispatching important proteins that I'm sure you have heard of, antibodies. They're made by special white blood cells, and they patrol the body's humors, or fluids like blood and lymph, where they combat viruses and bacteria moving around the interstitial space between your cells. Much of what you know or have heard about or think of when your immune system comes up actually has to do with your humoral immunity. It's why if you had mumps as a kid, you probably don't have to worry about getting it again for the rest of your life. It's also why doctors and nurses and patients who have been infected with the Ebola virus, a disease once thought to be incurable, have lived to tell about it. And it's why vaccinations work. One of the first steps in any good defensive strategy is to be able to tell your friend from your foe. And in the case of your immune system, that means being able to identify antigens. An antigen could be an invader from the outside world, like a bacterium, virus, or fungus, or it could be a toxin or a diseased cell within your own body. But in any case, antigens are large signaling molecules not normally found in the body, and they act as flags that get the adaptive immune system riled up. So let's say a flu virus gets inside of you, and it's floating around trying to find a good host cell to start multiplying inside of. Before it finds that cell, hopefully it will be paid a visit by one of the stars of your humoral response, a B lymphocyte. Like all blood cells, these guys originate in your bone marrow, but unlike other white blood cells, they also mature in the bone marrow too. And as a B cell matures, it develops the ability to determine friend from foe, developing both immunocompetence, or how to recognize and bind to a particular antigen, as well as self-tolerance, or knowing how to not attack your body's own cells. Once it's fully mature, a B lymphocyte displays at least 10,000 special protein receptors on its surface. These are its membrane-bound antibodies. All B lymphocytes have them, but the cool thing is every individual lymphocyte has its own unique antibodies, each of which is ready to identify and bind to a particular kind of antigen. That means that with all of your B lymphocytes together, it's like having 2 billion keys on your immune system's keychain, each of which can only open one door. So part of your immune system's strategy is just to win with overwhelming odds. The more unique antibodies your lymphocytes have, the more likely it is that one will eventually find, bind to, and mark a particular antigen. Once they've matured, B cells colonize or seed your secondary lymphoid organs like your lymph nodes and start roaming around in your blood and lymph. At this point, they're still naive and untested, and they won't be truly activated until they meet their perfect enemy match. Which brings us back to the flu virus. When the right B cell finally bumps into an antigen it has antibodies for, usually in a lymph node or in the spleen, and recognizes it, it binds to it. This summons the full power of the humoral immune response, and the cell basically goes into berserker mode. Once activated, the B cell starts cloning itself like crazy, quickly producing an army of similar cells, all with the instructions for the exact same antibodies that are designed to fight that one particular antigen. Most of these clones become active fighters, or effector cells, but a few become long-lived memory cells that preserve the genetic code for that specific successful antibody. This ensures that if and when the antigen returns, there will be a prepared secondary immune response that's both stronger and faster than the first. This is key to why vaccinations are so brilliant and important, which I'll come back to in a minute. But while the memory cells are just there to hang back and record things, the effector, or plasma cells, are packed with extra amounts of rough endoplasmic reticulum, which acts as an antibody factory. These cells can mass produce the same antibodies over and over for that particular invader, spitting them out into the humor at a rate of around 2,000 antibodies per second for 4 or 5 days until they die. And the antibodies they make work the same way that the membrane-bound ones do. They're just free-floating. So they ride the tides of blood and lymph, binding to all the antigens they can find and marking them for death. Now, antibodies can't really do the killing themselves, but they do have a few moves that could make it hard for intruders to take hold. One of their most effective and common strategies is neutralization, where antibodies physically block the binding sites on viruses or bacterial toxins so they can't hook up to your tissues. And because antibodies have more than one binding site, they can bind to multiple antigens at the same time in a process called agglutination. The resulting clumps can't get around easily, which makes it easier for macrophages to come and gobble them up. And not only that, but while all this is going on, antibodies are also ringing a chemical dinner bell, calling in phagocytes from the innate immune system and special lymphocytes from the adaptive system to destroy these messy little antigen-antibody clumps. So the point of all of this in the short term is to keep you healthy, but in the long term, this process also adds to your overall immunity. The humoral response allows your body to achieve immunity by encountering pathogens either randomly or on purpose. Active humoral immunity is what we were just talking about. It's when B cells bump into antigens antigens and start cranking out antibodies. This can occur naturally, like when you catch the flu or get chicken pox or pick up some nasty bacterial infection, or it can happen artificially, particularly through vaccination. Most vaccines are made of a dead or extremely weakened pathogen, and they work on the premise that because a secondary immune response is more intense than a primary response, by introducing a pathogen into your body, you're priming it to fight hard and fast should that antigen show up again. In the case of typically non-fatal infections like the common flu, this immunity should at least spare you from some of the most severe symptoms. But in the case of more serious diseases like polio, smallpox, measles, and whooping cough, vaccinations can be truly life-saving. Now, some antigens, like those from mumps or measles, don't really change much over time, so a few immunizations will leave you set for life. But others, like influenza, are constantly evolving and changing their surface antigens, so immunity to last year's flu probably doesn't work against this year's flu. Still, acquired immunity doesn't have to be active. Babies, for example, naturally obtain passive humoral immunity while still in the womb. They receive ready-made antibodies from their mothers through the placenta and later on through breast milk. And that works pretty well for a few months, but the protection is temporary because passively obtained antibodies don't live long in their new body, and they can't produce effector cells or memory cells, so a baby's own system won't remember an antigen if it gets infected again. You can also acquire this kind of temporary passive immunity artificially by receiving exogenous antibodies from the plasma of an immune donor. This is what recently saved some doctors and nurses who had contracted the Ebola virus from infected patients. A serum was made from the blood plasma of other medical workers who had been infected and survived. The antibodies helped defend the patients from the virus before their own active immunity could identify that particular antigen and start creating their own antibodies. It's not the same as a vaccine, which immediately engages your B cells, but it can buy a patient some crucial, life-saving time against an infection that would otherwise quickly kill. But B cells and antibodies are only part of the immunity equation. There are plenty of pathogens that quickly worm their way right inside your cells, where they're safer from the humoral response and free to multiply as much as they'd like. Luckily, your immune system has yet another game planned and a new set of players ready to fight that final battle with cell-to-cell combat. Your body's last-ditch efforts to defend itself at all costs. This is what happens when all the other fail-safes have failed. Your skin and mucous membranes did what they could as physical barriers against infection, and your humoral immune response cranked out antibodies in an effort to keep your interstitial spaces healthy. But when those systems weren't enough, your cells themselves were breached, and pathogens and abnormalities began to run amok where antibodies could not get to them. Now it becomes the business of your cell-mediated or cellular immune response. And that's where stuff gets real, where cell fights cell. T lymphocytes. These lymphocytes, known on the streets as T cells, go after body cells that have been hijacked by things like viruses or bacteria or become cancerous. T cells cause inflammation, activate macrophages, get other T cells fired up, and generally regulate much of the immune response, which is important if your body completely fails to protect itself, and what happens if your immune system goes rogue and attacks your own healthy cells. But even when they're functioning well, some of your immune cells are careening around your body. They're out to protect all of the tissues and organ systems, and these guys play for keeps. If there are cells in your body that look and act like they're from some post-apocalyptic hellscape, it's gotta be the cells in your immune system. Aside from the fact that they go around literally eating their enemies and have names like natural killers, some of these cells are dressed for the part too. Specifically, they go around wearing parts of the organisms they've killed so others can see them. Sounds a little bit messed up, but we're talking life and death here. The stakes are high. And this kind of behavior occurs both in your innate immune response and your acquired response. We've already talked about how in the innate response, when a phagocyte sees a suspicious character, it engulfs it and kills it, right? But what we didn't get into before is that during its attack, the phagocyte actually breaks the pathogen into tons of tiny molecules and then proudly displays those broken bits in grooved proteins on its outer membrane. These proteins are called major histocompatibility complexes, or MHCs. Because cells from both your innate and adaptive branches do this grisly accessorizing like it's their job, they are referred to as professional antigen-presenting cells. Which might make you think, is there an amateur version of an antigen-presenting cell? And yeah, there kinda is. Every nucleated cell in your body, which means all of your cells except for red blood cells, have one kind of MHC protein on their surface called class 1 MHC. MHC1 proteins present short chains of amino acids that are based on endogenous proteins, that is, proteins synthesized inside that cell. So if a particular cell is healthy, the antigens on its MHC1 tell roving immune cells that everything is okay inside, nothing to see here. But if the cell is, say, cancerous, and it's making abnormal proteins, then it'll fix bits of those proteins to its MHC MHC, which alerts immune cells that there's a problem inside and basically asks to be killed. Now, your immune-related cells, like macrophages, dendritic cells, and B cells, wear class II MHC proteins on their outsides. These are the professionals. Class II MHC proteins bind to fragments of exogenous antigens, like a virus that's been engulfed, broken up, and displayed to get the attention of other cells. And this is how MHCs are totally essential to the cellular immune response. Because the heroes of your cellular defenses, the T cells, can't actually detect whole antigens. They can only recognize them when they're all diced up and decorating an antigen-presenting cell. T cells are made in the bone marrow, but they mature in the thymus, the lymphoid gland that sits on top of your heart, and which is actually what the T in T cell stands for. And you have several different kinds of T cells, but the two you really have to know about are helper Ts and cytotoxic cells. Helper Ts themselves can't kill, but they can activate cells that do, and they help call the shots for the whole adaptive immune response. Meanwhile, cytotoxic cells are the ones that actually do the killing of the cells gone bad. Now, much like how a naive B cell carries antibodies for one specific antigen, a naive helper T cell has receptors that will only bind to one specific combination of a class II MHC and a particular antigen. If that match is right, the helper T bonds to the MHC antigen bit and it gets activated. Then, just like with the B cells we talked about last time, the helper T starts copying itself like crazy, making a few memory T cells as well, which remember that particular antigen should it meet one again in the future. And it also produces a whole mess of effector T cells, mostly more helper Ts, but also some regulatory T cells that I will get to in a minute. But the main thing the helper T cells do is raise the alarm that tells other immune cells that there is a problem. And they do this by releasing a cocktail of chemical messengers called cytokines. When a cytokine enters another helper T, that cell usually starts dividing, making more memory T cells and more helper Ts, which release more cytokines that keep boosting the signal. And some of those cytokines also go on to help activate the cytotoxic T cells. You know that macrophages from the innate system just sort of roll up and swallow pathogens whole, but cytotoxic T cells do their killing a little differently. They roam the blood and lymph looking for hijacked amateur body cells that are asking to be killed. Basically, these infected cells are already dying, so they've digested some of their invaders' proteins and stuck them on some of their class I MHCs, effectively waving a surrender flag made of fragments of the very virus or cancer that is destroying them. If a cytotoxic T cell with the right receptor floats by, it binds to the antigen MHC combination and moves in for a mercy killing. It does this by releasing special enzymes that punch holes in the cell's membrane or otherwise trigger apoptosis, killing both the cell and whatever is inside of it. Then the cytotoxic cell just detaches and continues to run down other prey. So by now it should be pretty obvious that without T cells there basically is no adaptive immune response, and it really all comes back to the helper Ts, which is why immunodeficiencies can be so deadly. AIDS, for example, is caused by the human immunodeficiency virus that specifically attacks helper T cells, and without the helper Ts, there wouldn't be much of a humoral response either. Because the cytokines that come screaming out of the helpers not only activate other T cells, but they also finish the training of the B cells. The fact is, most of your so-called naive B cells don't get fully activated and become memory or effector cells when they first bind to an antigen. And there's a good reason for that. Since antibody receptors are generated randomly, you might wind up with B cells that could bind to your own healthy proteins, like, say, your growth hormone. So once a B cell interacts with a substance, whether it's growth hormone or some dangerous bacterium, it still needs to bind to it, engulf it, and present some fragments of it on its surface. But then it'll stop to await inspection. It pauses until the right helper T cell comes by to check out its presentation. If the T cell binds to the presented fragment, then it releases cytokines which fully activate the B cell, and suddenly you got antibodies going everywhere. But if it doesn't, then the B cell just goes about its business and doesn't trigger an immune response. This check and balance between Bs and Ts is an important safeguard against your immune system becoming too good at its job, which is a very real risk. A hyperactive immune system can cause mayhem by losing its ability to distinguish enemy from self as it turns on your own body. Your regulatory T cells, another type of effector, help prevent this by releasing inhibiting cytokines that tell other immune cells to stand down once the initial threat has been handled. Without that regulation, the body might start cranking out too many antibodies and cytotoxic cells that could damage or destroy its own tissues. This dangerous confusion is what causes many autoimmune diseases, like multiple sclerosis, which eats away at the myelin sheaths around neurons, or type 1 diabetes, which tears up the pancreatic cells that make insulin. So the takeaway here is that your immune system is usually really good at its job, which is to kill stuff